All right, let's jump right into this explainer. Today, we're going to take what looks like a dry, standard clinical checklist and turn it into an absolute masterclass on pouching and ostomy. You know, whether you're a healthcare pro, a caregiver, or maybe a patient yourself, there is a massive difference between just memorizing steps and actually getting the mechanics of what you're doing. So we're breaking down the source material to reveal the science, the logic, and, most importantly, the empathy behind every single step of this vital procedure.
But before we even touch the mechanics, let's talk about the why. Mastering this isn't just about getting an adhesive to stick. No way. It is entirely about preserving a patient's dignity, keeping them physically comfortable, and completely blocking devastating infections. I mean, think about it. A failed ostomy pouch isn't just a tiny clinical oops, it's deeply distressing. Keeping that human element front and center, that's what makes you a true professional.
To get there, we're going to follow the why behind the what by breaking this down into 4 logical phases. We've got setting up for success, prepping the skin perfectly, sizing and customization, and finally, securing the pouching system. Let's get right into it.
Starting off with Phase 1, setting up for success. This is where your prep literally sets the stage for a flawless application. We start with the foundation. First, get your patient properly positioned. That could be standing, seated on or near a toilet, or lying supine. Once they're positioned and draped, you absolutely must do your hand hygiene and get those gloves on. Honestly, that's non-negotiable for infection control. Then, place a waterproof barrier right under them. It sounds basic, right? But it protects the bed and builds a clean, controlled workspace.
Now, if you choose the supine position, lying flat on their back, it's not just a hack to make your job easier by smoothing out skin wrinkles. I mean, yes, a flatter abdomen makes applying the system much easier, but here's the real kicker. It actively maintains their dignity during a super vulnerable moment. It keeps them covered, physically comfortable, and psychologically secure while you work your magic.
Okay, moving right along to Phase 2, prepping the skin perfectly.
This phase is all about hygiene and peristomal skincare, and honestly, this is where a lot of well-intentioned mistakes happen. Let me ask you this. Why should we avoid using soap when cleansing that skin? Instinctively, you'd probably want to grab some nice-smelling soap and warm water to get it really clean, right? Well, that is actually a massive pitfall.
And here's the simple reason why. Soap leaves behind a sneaky microscopic film, a tiny bit of residue. And that film totally wrecks the clean, bone-dry environment the skin barrier literally needs to stick. When the barrier doesn't adhere, moisture pools underneath, and boom, you've just skyrocketed the risk for nasty fungal infections. So stick to just warm water and a clean washcloth. And remember to pat it completely dry. Never ever scrub.
Now, to make sense of this next part, we need to know exactly what we're looking at. The stoma isn't just regular skin. It's a highly vascular mucous membrane. Basically, that means it is absolutely packed with blood vessels that sit super close to the surface. Knowing this little anatomy fact is going to save you a lot of unnecessary panic. Because it's so rich with blood vessels, do not freak out if a little bit of blood oozes onto your gauze while you're cleaning. That is perfectly normal. Sometimes a stoma will ooze just from the light friction of being wiped. But, and this is a big but, if you see active bleeding pooling right into the pouch, that is abnormal and definitely needs clinical attention. Being able to spot the difference between normal oozing and abnormal bleeding makes you a top-tier observer.
Wrapping up this phase, you absolutely have to use a dedicated adhesive remover for the old skin barrier. If you're thinking, hey, I'll just peel it off real quick and save some time, scratch that idea entirely. Ripping it off improperly causes painful skin tears, fires up the delicate tissue, and pretty much guarantees your brand new pouch is going to fail. You've got to treat that peristomal skin like wet tissue paper. Be incredibly gentle.
All right, let's head into Phase 3, sizing and customization. This phase is practically an exact science, because one-size-fits-all absolutely does not exist in ostomy care. You've got to remember that stomas change. Especially after surgery, they can keep shrinking for the first 6 to 8 weeks. Because of that shifting size, you must use the manufacturer's measuring guide every single time. And when you're cutting that custom opening, you want it to be precisely 1/16 to 1/8 of an inch, or around 0.15 to 0.3 centimeters, larger than the stoma. Seriously, it's a game of millimeters here.
And the stakes for getting that measurement wrong? Oh, they are high. If you cut it too big, caustic fecal drainage can sneak right under the appliance and sit on unprotected skin, which causes severe chemical burns. But on the flip side, if you cut it too small, the rigid edge of the appliance will literally slice right into that highly vascular stoma tissue we just talked about. Precision is absolutely your best protection. Now here's a pro-clinical tip to keep in your back pocket. If you're dealing with an ileostomy that's just producing a massive volume of liquid output, you really should consider upgrading to a high-output pouch. This is a game changer. It securely holds all that liquid and takes away the exhausting, constant burden of emptying the pouch for the patient.
And that brings us to the final stretch, Phase 4, securing the pouching system. Before we attach anything, let's get our equipment straight, because the steps are a bit different depending on your setup. You've got your unified one-piece system, where the pouch and the skin barrier are completely fused together as a single unit. Then you've got the modular two-piece system. That one has an adhesive flange that goes on first, and the pouch snaps onto it separately.
If you're working with the one-piece system, you'll start with skin sealant wipes to protect the area and let that dry completely. Then you'll press the adhesive backing smoothly against the skin. Start right at the bottom and work your way up and around the sides to iron out any weird wrinkles. When you center it over the stoma, the standard move is to point the bottom of the pouch straight toward the patient's knees to let gravity do its downward draining thing.
But hey, clinical context is everything, right? If your patient is confined to a bed, pointing that pouch at their knees makes zero sense. You have to adapt. Position the pouch horizontally, pointing over the side of their abdomen. This lets gravity work properly while they're lying flat, saving you and them from messy backups and leaks.
Now for the two-piece system, the workflow shifts just a bit. First, you apply that adhesive barrier paste flange directly to the skin, making sure it's nice and snug. Then you line up the pouch and literally snap it onto the flange. You'll usually feel or hear this incredibly satisfying click. And you know, that little auditory feedback is awesome because it tells you, yep, the seal is locked. But regardless of which system you use, the most critical step happens right after you apply it. You absolutely have to maintain gentle finger pressure all around the barrier for 1 to 2 full minutes. Why? Because that gentle pressure, combined with the body heat radiating from your hands, literally warms up the adhesive. It helps it mold perfectly to the tiny, microscopic contours of the patient's skin. Whatever you do, do not rush this minute.
To wrap up the physical application, you always do a final check. Just give the pouch a super gentle downward tug. If it holds firm, congratulations, you just created a secure, wrinkle-free seal that is going to properly protect your patient.
So as we wrap up this explainer, I really want you to think about this. How do these seemingly tiny mechanical details impact a person's life? Avoiding soap residue, tweaking angles for gravity, using the warmth of your own hands. These aren't just arbitrary bullet points in a textbook. These are the exact techniques that give a patient the confidence to go out and live their life, free from the terrifying anxiety of a pouch failure. Mastering the why behind the what changes absolutely everything. So what other standard procedures could you completely transform just by understanding the why? Thanks for joining me on this deep dive.